190. So
we are. So I wonder if we should start. We've got quite a busy day.
we have, and we've got lots to tell people at breakneck speed as it is.
Okay, so let's get going. And we've just gone past 200 people. So welcome to all of you. For those of you who don't know me, I am Christine Lenihan. I am the Director of the Council for Disabled Children until tomorrow. And then on Monday, I am very, very delighted that Amanda Allard, who's with us, will be the new Director of CDC. So you are my last event. And I'm very, very pleased to be here. Because what we're going to talk about this morning is improvement. Julie Hickling, why have you got your hand up? Manchester in action.
Well, Sheridan Dodsworth got a hand up as well.
Imagine their hand.
Oh,
I see.
they clap your hands.
All right. Oh no, we like clappy hands, Julie. Don't worry about apologising, especially from Manchester. So that's all right. Okay. Good morning and welcome. We have a housekeeping slide for you, which will come up magically. There you go. Yes, please can you mute, turn off your cameras when you join, unless you're a speaker, and then we'll bring people in as we can. And please can you use the chat. The chat moves at fabulous speed in these events, but Adiba, who's with the team this morning, is keeping an eye on it for us. So if you can use the chat, then we can get a feel for what's happening. And if there's the same question coming up again, we can answer it. And before you ask the question, yes, you will get the slides. Yes, this is being recorded. And yes, we'll send you all the information. So there we go. Okay, this event this morning is part of the RISE programme. It is funded by the Department for Education, and it is part of our work supporting improvement throughout the system. So it is a good place to start. And the slide that one of our colleagues has put together for us tells you a bit about what's happening there, really. And the things that are common for us: co-production, outcomes and data, EHC plans, preparation for adulthood, and telling your story of improvement, which is a good place for this morning's thing. So who are you going to hear from this morning? You have the joy of listening to me in a bit. And then I'm going to introduce Alistair Durden, who is from the Department for Education, and he's going to give us a big update on the SEND and improvement plan and the change programme, which was launched now last week or the week before. But anyway, you'll get an update. I'm really, really pleased we've got Amy here from Warwick, and Warwick University have been helping us understand whether what we're doing is making a difference. And that's really, really important. So Amy's going to be talking to us about the systemic review of the RISE programme. Are we targeting the right things in the right place? And are we providing you with the support that we've got? And are we taking that learning forward? And then Lorraine Mulroney from the NHS England team will join us later on to talk about the reflections of the NHSE SEND team and the work that they're doing across the country. I'm really good to see so many of the health teams with us today. Okay, we have our usual fab selection of workshops. And if you haven't received from our teams your workshop links, then can you let Adiba know in the chat, and we will make sure you are linked into the right places. Is it best in the chat or by email, Adiba?
By email.
By email, please. And Adiba will put her email in the chat. So if you can do that, if you're stuck, we can sort it out before the workshops start later, as you can see. All right. We don't take a break. Well, I am going to, but in general, the team doesn't take a break. And our next national webinar will be on SEN case teams. And that will take place, as you can see, on the 22nd of November. We want to understand the work of these really important teams, how they're supported, and what we can build around them. The invites are not open yet, and these webinars fill quickly, but as soon as they are, we will make sure you have that information. Okay, right. Apparently, my first job of the morning that tests my ability is to introduce a poll. Yeah. So we are going to start today with a poll, and the poll is going to ask you a question. And the question is, can you rate your current understanding of the SEND and AP improvement plan. So if you access the Menti code that is now on the screen, you can press buttons that tells you, yeah, it's wonderful, I know everything to know, or what are you talking about, and anything in between. So we're going to give that a go and see where we are. Okay. Thank you, Adiba. Right. How long's the poll open for, Adiba?
A few minutes, I think.
A few minutes, all right. We'll start that to come. We're going to do a poll at the end of the morning, just to tell you again, with hopefully a better result that says even more of you understand the SEND and Alternative Provision Improvement Plan. But what we want to do today is work out how much information is getting out there, how much of it you feel is relevant to you and your practice, and how you can link in to the things that are happening.
How are people doing with the poll, Adiba? Are they getting in?
I'll stop sharing my screen and I can share the results from the poll if most people have been able to do it now.
Thanks, Macy. Okay. Oh, that's pretty good, to be honest. Currently 114 of you have some understanding. The 16 of you completely understand are obviously officials who work for the Department for Education or work for CDC, I think. And the little or no understanding will welcome, because this is a brilliant event for you, because we are going to make sure by the end of this morning you have some understanding. And for those of you with some, let's hope we can move you from amber to green. All right. Okay. So I am going to start. I have no slides. I'm just going to talk to you. What we're going to have when I finish is we're going to have a session from Alistair at DFE, as I've said. So you'll get the details of what the SEND change programme is and how it fits together. And, you know, again, we will send you all the slides afterwards, and there's always time for questions. But I wanted to start off with some reflections, a bit about why the change programme came together, the things that we're trying to do culturally, and why it matters. And I've been doing a lot of reflecting on this over the last few weeks as my last week of director. And so let's think, somebody asked me the other day, so when did the Children and Families Act start to go wrong? You know, it's an interesting question. And I think if we think about where the challenges are in the system, whether things have got wrong or not, let's lay out those challenges and then build on the challenges for improvement. So when the Children and Families Act came in 2014, the world was a different place. Yeah. So we'd had staff who had gone through the Andrew Lansley reforms in the Health and Social Care Act, who really hadn't been engaged in process as their system changed around them. And they were trying to work that out. We managed to do some things which have become really, really important, like creating the DCA, Designated Clinical Officer, Designated Medical Officer role. And that has been an incredibly important piece of work. And we are always delighted when some of you join us. So we were able to do some things that secured health in 2014. And then what happened is the system changed again, and the system's changing again now. So changes in health and trying to understand that. The speed of change means that when the 2014 Act was going through as well, we were at the very early part of a world of change in education, of multi-academy trusts, of free schools, all of that. You know, so trying to understand now how the world of education has changed. You know, at one stage, all schools were locally maintained. We had a sort of central support services, you know, it varied a bit and whatever. That's how it worked. That's how we held it together. Our landscape became much more complicated than that. It's not to say it's better or worse, it's just different. I think the other thing, though, is when we brought in the 2014 Act, the focus became on the move from statement into EHC plans. And for those of you who were working in local authorities at the time, it must have been a nightmare, because that's all you were ever asked. Where are you up to in your statement in? Have you got the plans? Have you done that? Have you done that? Have you done that? And I think somehow or other the focus on that lost the framework. It became the only thing people knew about, the only thing people understood. And we were doing some work the other day in a local authority, and the NHS provider collaborative was there. And what they said was, well, we just tell people if they need support to get an EHC plan, because we don't know what else is on offer. It is the only thing that we need. So, you know, so there's a bit about, we sort of lost the framing and culture of the system, and we became focused on some of its processes. Matthew, we agree entirely that the DCO role needs to be made statutory. And when hopefully in the new Parliament there is parliamentary time for change for legislation in this area, as there will be, that will be one of the things that we will be campaigning for. But so we've had a changed, complex landscape, and then we had a pandemic. And we were left with a very changing world, really, for me. Something about understanding where anxiety was, the link with mental health, some of the new issues emerging very strongly about autism and girls, some of the challenges in the system. So I think what we've tried to do in the last while is stand back and think, okay, if this is all the challenge in the system, angry people, angry systems, very, very tired professionals, what is the best we can do to make change? And as part of that, you'll start to see that in the change programme, because some of it is about going back to basics. This is all about culture. The role of CDC regularly is to get people in the same room, just to give them a bit of space. What do we all want out of the system? There isn't a single person on this call that wants to do anything other than good. That's why you're here. That's why you come to work. That's why you campaign for your child. So how do we harness that positive energy in the system to look at what inclusion is, what improvement is, and how we bring together all of the evidence around it and start to build the building blocks? The other side of the improvement journey at the moment, you'll hear bits of today, is obviously we also have a new inspection framework. And we are looking at local area inspections from the Care Quality Commission and Ofsted. And at CDC, as in many places, we track those inspections. We want to know what people are saying. We want to understand what good looks like. We want to know where the challenges are. And so we also want to look at improvement at that end of the system as well. And I suppose the challenges reflect a bit about what the RISE programme is. Challenges we are seeing coming through are a real trying to understand the rise in education, health and care plan requests. So we now have 517,000 EHC plans in the system. It's a massive rise over the last few years. It's rising in two areas need primarily. It's rising for children who have autistic spectrum disorder on that continuum somewhere, and it's rising for children who have social, emotional, mental health needs. So really understanding how things are rising and what we can do to work with that. Not just keep catching up, but actually, again, that step back to think, is there a better way? Is this the only way of providing children the right support that they need at the right time in the right way? Or are there better ways of doing it? So really having that chance to think, rather than actually being driven by a target that says you must fill this form in this time and whatever. Processes are fine, but how do we make sure that when we're doing that, we are also ensuring the best outcomes for children? And we're not.
You've gone on mute, Christine.
Am I back?
Yeah.
Oh, thank you very much.
That was Leslie.
That was Leslie, I could tell, which is good because I'm about to talk about the NHS. And the NHS, we've been looking at a struggling NHS. What we've been looking at is one of the biggest challenges that we're seeing, that all of you will see, is waiting lists. waiting lists for neurodiversity assessments, waiting lists for speech and language therapy, waiting lists for OT, physio, etc. And inspectors are picking up on the lists, and it's given us a chance to sort of think about waiting lists and funding. Yeah, and I do think it is completely unacceptable that children are in some areas waiting 3 years plus for speech and language assessments, for example, because we know that actually that early intervention on communication for so many of the children we work with makes a massive difference to the rest of their life. So we took this to health ministers 2 weeks ago maybe or whatever, and talked to health ministers about
And we've lost sound again.
all right, hold on, we'll sort out the technicalities at our end. We seem to have a dodgy speaker.
Okay, she'll be back on sound.
Are we back?
Yeah, we can hear you now.
Yeah, sorry. Dodgy speaker seems to be the technical answer from my team in the room. But yeah, if it goes again, let us know. Somebody's going to find a new speaker. So we know that staff who work, please will you go back to what you told health ministers? I will.
Don't class yourself as a dodgy speaker. I think that's exactly what she is, Matthew, a very dodgy speaker.
Indeed. Yeah, exactly. So one of the things we've been looking at are, there is, we go back to the infamous postcode lottery, don't we? And by the way, I have banned, so if you come across me, health staff who occasionally tell me that it's all right, Christine, because people are waiting well. I think waiting well is a ridiculous phrase, quite frankly. So we're trying to think of a better one. But what we have said to ministers and to others is, look, the challenges now in waiting lists for children are such that they will impact children's lives. And that doesn't mean that staff in health are not working hard and doing what they can. But if we can't intervene early enough with some of these children, if we can't intervene early enough for children, that will have a knock-on effect in their education, in their social life and whatever. So ministers were interested in looking at, can we change the basis for the current waiting list so that actually we have a stronger drive in order to improve them. So as you know, from an NHS point of view, if it's in the mandate and it's pushed, it happens. If it not, it disappears a bit. So really trying to push now this idea of how we do that. And I suppose at the same time, really trying to think with local areas about, is there a way that we can't magic staff overnight? We can't magic paediatricians, speech and language therapists, educational psychologists thinking of education, health and care plans. But is there a way of doing things differently? Are there ways we can support people? What is it we can do? Whatever. So those tend to be the two biggest areas. Yeah, they do. Oh, I like supporting whilst waiting. Yeah, that sounds fine. I dislike waiting well as well. All right, we are changing speakers. Talk amongst yourselves. Okay, this is the new speaker. Yeah, it's what we can do. Yeah, I think the other thing that's nationally recognised, I can see it coming up in the chat, is recruitment. So recruitment's nationally recognised across the piece. Yeah, from teachers and teaching assistants in schools through to therapists across, etc. So it's a real focus, and I think government recognises that there is a problem. So there is a big piece of work. I'm trying to think which university is doing it. Can you remember who's doing the research on King's? So the government commissioned King's College to do some work on therapy waiting lists and therapy gaps. We want to have enough evidence to show where the gaps are. Now, you lot know that there are gaps there, but sometimes when you're trying to get more money out of a system, what you're having to do is to say, let's prove the case that this is needed, and then we can argue for the money. So there's a bit of that going on, etc. And I think also, so there's that work's going on to recognise the challenge in the same way that the DFE is also looking at what we can do about teacher recruitment, and I think crucially TA recruitment as well. So there's quite a big piece of work underway on the role of teaching assistants, for example, how they can provide support, etc., etc. So I think the workload issues are key. I think the funding issues are interesting, and I suppose Alistair will come on in a bit and tell you the sort of formal process of the improvement plan. But it's important to remember that part of it, and a really important part of it, and I know this sounds odd, but it is actually showing what improvement is and showing what the system needs to improve, so that also at the right time we can go back to the Treasury and be able to say, look, we've shown you we can do improvement. This is where the funding gaps are. And so this is the next request for funding into the system at the right level. Because what you're trying to do all the time with the system for improvement is you're trying to move from a system that runs at crisis to a system that runs at early intervention. So all of you know that in your different roles, the thing that we need is services that are early, services that are timely, etc. So it's trying to work out how you can show the system that that move is possible, and then look at what it takes to fund it. So you're not always having to double fund when you're trying to do early intervention, but you're always responding to crisis, and you're always doing that. So that's the rejig in the system that we are interested in terms of looking at it. And a number of you are talking in the chat about the political nature of the system, and that's of course absolutely right. The Council for Disabled Children does not hold a political view. However, within the next 12 months or so, there will be a general election. And I will be very clear as an individual, and in whatever new role I do, that actually we have to make children a priority in that election. We have to be really, really clear about children and the lives of children, etc. Given everything that everyone's been reading, everyone's been seeing about what's happening in the world of children. And yeah, it's really hard to get children on the health agenda. So that's absolutely right, and that's why I think the timing as we move forward. And at CDC with our colleagues in NCB, we run something that's called the wonderfully named HPIG. And HPIG's our Health Policy Influencing Group. And that's how we work across health to understand health, to work with colleagues in health and parliamentarians about the changes we need, which continually are about bringing children's needs back and children's needs back. I want to sort of end by talking about something different. All of the challenge in the system that you talk about, going through the chat, is of course completely real. I'm not denying it for a second, but if we are going to get change in the system, we have to believe that change is possible. So I've always been somebody for whom, when people tell me that the system is going to hell in a handcart, I think, well, fine, but in the meantime, families and children are living their lives. They're using the system, they're expecting the best out of the system, they're expecting the best for their children. So there's also something that's going to be really, really important in improvement, which is about cultural change and belief. Us believing that change is positive, even on a day where it all seems to be going horribly wrong, but believing that change is positive because that's what families and children need. So one of the things we are doing here, and you'll start to see more of it come out through Warwick University, for example, is the What Works in SEND programme. Is the actual starting to really understand over the next couple of years, what does good look like in our system? How do we understand good? What does it look like? How can we see how far off good we are? But how can we really, really confident that that's where we're going and that's what we're getting to? And how do we share that message of confidence with children and families? So those are some of the things in terms of the backdrop to where this programme comes. Yeah, as part of one of the things we're doing, just so I finish on a piece with Anna, who's our lovely deputy director sat next to me, is the piece of work that we are doing, looking at health and the understanding of health and how it works with the law and how we are all confident that we understand the levers in a changing health service in order to support children. And Anna, you're hoping to get something to people by when?
Yeah, an updated briefing on SEND and ICB and the accountabilities in November, and then some regional workshops for a broader than health audience in Q4, so between January and March.
So look out for that. We're really excited about it, and it is about bringing people to the table, understanding their roles and saying, okay, together we are going to make this happen. All right, I think that is about me, but thank you very much for your time and your indulgence in my meanderings. And I'm going to hand over, I hope, thank you, Leslie, I hope to Alistair, who I hope is here and will talk to us about the SEND and AP improvement plan.
I am here, Christine, thank you.
Excellent.
Hopefully everybody can hear me. I don't know if you're presenting the slides from your end or you want me to do them from my end. Either is equally acceptable.
I can share them for you. I've got them open.
Great, Macy. If you go for it then, and I'll just do the Chris Whitty next slide impression at the right points. So for those of you that don't know me, my name's Alistair. I work at the Department for Education. I'm head of the local implementation unit with responsibility for the SEND and AP change programme. Christine and Amanda and others and I go back away because I'm also a veteran of the 2014 reforms, and I'm never sure whether I should own up to this, but I'm one of the co-creators of the Education, Health and Care Plan, and also the genesis of things like supported internships. So I work very much on the preparation for adulthood side of the reforms last time round, and I think I would just echo some of what Christine said as I start, that I think most of us, still accept those reforms were the right thing to do, but in implementing them, we got lost a little bit along the way. And I think in particular, the two things for me were that we got so caught up in the process of converting statements to education, health and care plans, we lost the change in the way we wanted everybody to work together and how those plans should operate, and they just ended up being a cut and paste job from one to the other. And then we got behind ourselves, and then we got to annual reviews and discovered that what we cut and pasted into education, health and care plans wasn't what education, health and care plans were meant to be, and it just spiraled down from there. And I also think we didn't support the system well to implement those reforms and to really drive that culture change, particularly in and around schools, and particularly really using the local offer as a basis for creating sort of an early intervention system, which was, again, something we really wanted to do. And I think this time round, hopefully you'll pick some of that up as I go through these slides. That's what we're trying to address in the way we're approaching things this time. So moving on to the first slide, which is just a reflection on the improvement plan really, and the theory of change behind all of this. So hopefully some of this is familiar to you. And again, Christine has touched on some of these things. There have been three key objectives in the improvement plan and in the original green paper, which are around delivering better experiences for families, children and young people, improving their outcomes, absolutely key, and doing that within a system that is financially sustainable. As most of you will know, I think we're spending in excess of 10 billion now on high needs, and that's due to be increased, I think, by another 1.5 billion by the time we get to the end of this financial year. So it's not that we're not putting money in. I think there's a question about how effectively are we using that money, and particularly where we've got a system that seems to, and again, Christine touched on this, wait until everybody gets to the acute end of the system before we start to do something to help them. And that's just ridiculous. It's, you know, anybody who's been around in this space a long time will know we've always been trying to get to an early identification intervention system. And I think it's really difficult to do. All the complexities, all the interactions, all the different bits of different systems that have to come together make that very hard. But in simplistic terms, I guess I'm really fed up of hearing the story about the 15-year-old with a reading age of 7 who's been chucked out of school, is in some high cost provision with mental health issues as a result of their horrible journey through school. Why? if an intervention when that child was 5, 6, 7 years old would have got them back on the right track, sorted it out, and they'd be fine, and allowing the acute end of the system to really operate and work as it should for those that really need that level of complex support. And it's trying to get that balance right here, and that's why we've drawn it as a balance bar. Really, it's just how do we balance this so that people are getting the right support at the right time, the right place, which was the strap line of the green paper and the improvement plan. So we need to release the resources to work more effectively so that those that need the high cost end support get it quickly, and it's well resourced. But actually we do that by helping those. Actually, if we intervene early and identify minor issues and get people back on track, we actually save them from having to slide into that acute end of the system before they get the help they need. So it's really, really quite a big challenge. And I think that was the intention of the reforms last time. We didn't pull it off. So this time round, we're going to have another go at seeing if we can shift that culture and particularly get some of that Section 19 stuff, which was all about how we work together, how local authorities should approach this, really embedded in the system. How we're going to do that through the change programme. So the next slide will just take you through a little bit of the structure of how that's going to work on the ground, and I'll unpack how it all hangs together as I go through. So the model that we're going for here is really around, it is a test and learn or a test and refine model. So we are taking some of the key things from the green paper and the improvement plan, saying, let's check that they work. Let's really make sure that when you hang them all together and you embed them within the existing system, that the sum is greater than the total is greater than the sum of its parts is the phrase, isn't it? That actually it works cohesively together. It delivers those objectives, and it helps us to understand what it's going to take to get the system from where it is now to where we need it to be. And I think key to that, last time round, we picked a bunch of really good local authorities. We created some pathfinders. We gave them some money. We put them in a bit of a bubble. Everything looked fine. And then when we released that into the wild, actually, it was a lot harder for other local authorities to implement those things. This time round, we've actually picked quite it's quite a random selection of local authorities beyond the lead local authority to work together as geographical clusters. And some of those local authorities have got written statements of action. They've just failed their Ofsteds. They're actually in really difficult places, and that's deliberate because we need to understand what it's going to take to get them to move to the position we need the whole system to be operating in, as well as what does it take to get the best, who are probably close or close-ish to where we need them to be, so that we can understand the scale of the challenge and the problem here. And so the change programme is built around that basis, with the lead local authority and then 2, 3 other local authorities as partner LAs, geographically co-located. And there's one of these in each region, so there'll be 9 change programme partnerships. You can see from the slide they're going to get just over 6 million per partnership over the sort of next 18 months, 2 years. And there's going to be a lot of support coming in from my unit, from DFE, and a lot of support from an external delivery partner, which Christine and Amanda and others are part of that delivery partner. They're called Reach, which I have completely, acronym's completely gone out of my head. So somebody might want to pop that in the chat. Amanda, if you put that in the chat, because it's completely gone out of my head. And headed up by PA Consulting, CDC are partners in that, Empower are partners in that, and Olive Academies Trust are partners in that as well, to bring the AP expertise. So real mixture of system transformation expertise and actual SEND and AP expertise in the mix that we will tailor to the different, tailor to the different change programme partnerships as needed. Everybody's going to be testing broadly the same thing, because you'll remember that one of the drivers for the improvement plan is that we get to a nationally consistent system. We tackle that postcode lottery issue, and we want to make sure that actually what we're testing it with a degree of consistency between each of the CPPs. Obviously, there's going to be local variation, and that's fine. But how do we drive towards a system that we can hold, we can create national standards for, and deliver that national consistency? schools, health partners, parents, carers, children, young people all need to be part of that partnership. So co-production is really key, and actually trying to tackle, as some of you have already been saying in the chat, that interface with health is going to be really important. We've got some levers in there that I'll come on to that should help. Next slide just shows you where they all are, the change program partnerships. So I won't dwell on this, but you can see those. So we've got one in each of the DFE regions, and like I said, a real mixture of good LAs leading that, LAs that we think did well on the SEND and AP delivery, mixed with some other LAs of different capacities and capabilities in a deliberate way to see how all that works. And then moving on in terms of the policies that we're going to be testing out from the improvement plan, which we've briefly summarised on the next slide. And this we've sort of chunked up into three blocks, really. We're calling the first block enablers. So what are the things that we need to put in place that actually enable local areas to work together? So that's your plans, your partnerships, your data, what's your accountability structure, those sorts of things that the improvement plan talks about, and I'll unpack these in a little bit more detail in a moment. Then in the middle block, and I think you'll hear it when I get onto the next slide, I think this is really key. What does ordinarily available provision look like? What's that early identification intervention model in and around the school system, the mainstream education system, so early years schools and post-16? What does that look like? How does that hang together? How does that actually start to drive the change in the system? And then we got some sort of EHC plans, stroke process things that the improvement plan talked about around multi-agency panels, strengthened mediation, format of the education, health and care plan itself, and the advisory tailored lists that are going to be in that end of the process as well. So those are broadly the three sort of blocks of reforms that we are going to be testing and trialling through the change program. And then the next slide sort of tries to articulate in a visual form. We used this at the conference the other day, so hopefully it sort of works. What does this look like? How does it hang together as a single system, as a single piece? And what you have over on the left are those enablers. So how does the SEND and AP partnership come together with all the relevant partners in a local area? How does it use the data that it's available in the data dashboard that we're going to give it, a prototype data dashboard, to say, actually, this is what needs to change. This is how we need to deliver these things for the children and young people and families in our area. And how do we set that out in a local area inclusion plan that gets published and is available for everybody to see? Some local authorities are going to have something that looks pretty much like this already, and it just needs a bit of tweaking, a bit of refining. Some are going to have to go on quite a journey to get to something like this. And underpinning that side is, at this stage, it'll have to be based on the funding and how they work together. Possibly in the future, it'll be around legislation, is how do they hold themselves to account for delivering that? And how do we hold them to account for delivering what they set out in their inclusion plan? So accountability is very much part of what we'll be exploring through the change program. And then that takes you into how are they going to deliver what we're calling ordinarily available provision. And there's two elements to that. There's what are we expecting the practice in a school to look like? What's good practice in school look like? And, you know, I don't think we're going to change the Progress 8 performance measures overnight through this program. So I think we have to understand that there's some context that we've got to try and make this work in. With that said, there's a whole lot of stuff we can do in school that is going to help improve the journey, I think, that children and young people take through their education. And it's one of those situations at the moment, and Christine May alluded to this earlier as well, where I think the stars align a little bit, and actually we've got the school system on board with going, how do we do this in a more inclusive way? How do we get the right support in at the right time? And I'm going to the Confederation of School Trusts conference next week in Birmingham, and they came to ours last week. There's a real sense of this being joined up in a way that perhaps it's not been before and everybody's agenda actually aligning and being on the same page. It'll be one of those moments that we need to grab with both hands and make work, because it will be a moment that passes if we don't. So I think that right now we've got an opportunity to really work with the school sector to make this work. And part of the sell to them then is, how do we build, using the children's social care terminology, that team around the school approach? So it's not just about saying schools, you've got to do more, the whole of the burden of this is on you, somehow you've just got to improve what you do in schools. It's also about, how do we create those quick reaction specialist support interventions around the school that the school can draw on quickly. So if you've got a child with a mental health, emerging mental health need, you're not waiting for a year to get some CAM support, because by then it's too late and that child's probably slid to the acute high cost end of the system, and all sorts of other things will have kicked in terms of their needs. How do you get that quick response? And some specific things we're doing around that. So we've got the AP service, really wanting to push quality alternative provision to actually reach out into mainstream school and provide some of that early intervention work that actually stabilises a child where they are and enables them to get back on track and do absolutely fine and stay in the mainstream. Possibly sometimes lifting them out for a temporary short-term approach, and for some lifting them out on that longer term approach, which might actually be to a different school or even into special school for those that actually need that more intensive support for complex needs. But actually, how does that system respond better? And then LSEC on there is early language support for every child. See, I can remember some of my acronyms, and that's very much working jointly funded with NHS England, to bring in the ICB and say, right, how do we create some community workforce, speech and language professionals that can actually react and respond really quickly across early years and primary school, to say, how do we, as soon as we see a child who's not quite meeting those age-related expectations, let's work out what's going on and let's put in the appropriate intervention and take the right action. And then we're also promoting things like our AP specialist task forces and our support, achieve, fulfill, exceed task forces that are around mainstream education, again, that are very much about those community-based multidisciplinary teams that react and respond really quickly when an issue is identified with a child, and actually we need to get something in place as soon as possible. If all that works, your flow into the EHC plan end of the system changes, because there's a whole bunch of kids that are getting support straight away. They're getting it when they need it. They don't need to go through a convoluted statutory process to get there. It just happens because we've built a system that works. So then it makes the EHC plan end of the system, for those that need that more multi-layered support because their needs are also more complex, work much better. If we can do that through a more co-produced multi-agency panels, through better mediation services, trying to tackle this issue of whether the EHC plan needs to be standardised and potentially eventually digitised. So this is the sort of precursor to thinking about what might a digital EHC plan platform look like. And then getting to a point where actually the tailored lists, that I know is one of the more controversial areas, is more about, actually, this list that a parent gets presented is the list of schools or education institutions that they've been talking about with the practitioners that are working with them all the way through the process. So there aren't any surprise omissions on there, and there aren't any surprise inclusions on there. It's like we all have a shared understanding of what a child's needs are, what outcomes we're trying to achieve, and therefore which institutions are going to be best placed to meet those needs. All of that then informs national standards and reform around commissioning. And we may get a chance in the Life of the Change programme to test some of those national standards. We'll just have to see how it goes, because we're really up against it in terms of timescales. We're much later. This should have started last year, basically. So we're very late starting, and obviously we're going to have an election in the middle of this. All of that then informs what we might do in terms of changing legislation in the future. And it's less about changing rights, parental rights, and more about how we would legislate to underpin the way we want the system to operate. So how could we legislate to hold local authorities and the health partners and others to account for delivering in the way we want them to do? So it's that system level change rather than necessarily tinkering and changing individual parental rights and those things. It's a different end of the system, a different approach that we're trying to do. And just to finish really, and then I'll throw it open for questions, because I'm quite happy to take lots of questions and challenges, as I know there'll be many. On the last slide, just a reflection on our launch event from last week. We had well over 200 people in the room in Church House in London last week. Christine spoke. Amanda was on our Q&A panel towards the end. We had Tina from PCF there. Mark Vickers from Olive Academies Trust. Andre, many of you know Andre Imich, was there too, and we were really sort of pushing and presenting to the change programme partnerships. All 9 of them were in the room, what it is we want them to test and what it is we're really driving at through the changes. And I think it was a quite successful event. Others that were there might want to comment. We've had lots and lots of positive feedback. We had really good turnout from the great and the good. So not only was Christine there, but David Johnston came, the new Minister for Children and Families. We had our Permanent Secretary came and did a session. Parent Care Reform were there, as I said, and the Confederation of School Trusts also came and did a slot on how schools are vital to driving this more inclusive approach. So there's, again, like I said, there's a real opportunity, real sense that we've got a moment to drive some real change here within the context and the complexities of the systems that we work with. So that's sort of where we are. Just I thought a couple of little visuals there to see how we'd got on with that event, and we're now cracking on with actually doing the hard part. The event was the easy part. The hard part's actually going away and doing the work now. So we're all, my team are meeting with the change programme partnerships over the next few days, really beginning to build some momentum and get this up and running, get their planning sorted and in place. So that's a whistle-stop tour of the change programme. The last slide is just an any question slide, so I'm happy to throw it open. I don't know if somebody wants to facilitate this, but if you want to pop hands up, or if somebody wants to draw my attention to anything in the chat as well, which will now move extremely quickly and I probably won't be able to keep up with it, but happy to take questions, comments, reflections.
Okay, thanks, Alistair. We can manage the chat from here. Don't worry, we've been keeping an eye on it. And so I suppose what I want to start with is we had a lot of interest in your presentation, and certainly I found the event last week really, really energising. The amount of positivity in that room from all partners was key, I think. Absolutely. So, and somebody liked the lunch, so that's even better. So I suppose one of the questions in the chat is, obviously you're a DFE official, and so people are talking about this being a very education-based programme, but it'd be really interesting if you can give us a few insights into where you see the role of health and care in the programme.
Yeah, so health, I think, and as a veteran of last time round, it's absolutely important that they're hardwired into this. And I noticed some comments earlier about we need to legislate to make health involved. And we sort of did that last time and it didn't make much difference. I think there's the big question. I think people talk about custom and practice, don't they, when it comes to health, and not necessarily what the legislation says. And I think we do need to shift some of that. So part of the advantage of having the early language support for every child pilot embedded in the change programme is that brings the ICB to the table, the Integrated Care Board, because they have half the money for that pilot and the local authority has the other half. So they can only make that pilot work if they come together and work together. So that immediately creates a lever of bringing the Integrated Care Board to the table, and being part of that. What we've asked every change programme partnership to do is set up a steering group to oversee the change programme, and we want the ICB to very much be on that and be engaged in that, because that also means that we're working very closely with NHS England at the centre. We can start to have those conversations saying we want the ICB to be involved for more than just running the LSEC pilot. We want them to be involved in all the other bits and pieces as well, because actually it's absolutely vital if we're going to build this early intervention system that health practitioners and the strategic thinking of health on the ground is really much aligned to that. So I think, again, we've got an opportunity to make this work. I suspect we will discover in some areas it's easier to achieve than in others, but that is part of what we want to learn through the change programme, is how easy is it to get some of these partners on board and get them involved in working with us. So therefore that gives us the evidence to go back and say we need to do X, Y, and Z to make this happen, because if we don't, it won't happen on its own. Too much of this stuff, I think, over the years, and many of you will be familiar with this, is where there are good people, stuff happens, and where there aren't, it doesn't. And when those people move and go and get a different job, the good thing that was going on quite often grinds to a halt, because the people that come in behind don't have the same interest, passion, priorities, whatever. So how do we create that framework to make sure that health are very much part of this? And children's social care, a number of our excuse me, change programme partnerships are also testing some of the big reforms coming through children's social care, and we're very much saying we want you to join those up. Where there's that overlap between that cohort of children and young people that are in both, both in the children's social care system and SEND and AP. How are you actually making those things work together and come together as a single piece?
Start to run out of time, Alistair, but one of the big questions coming up on the questions coming up on the chat are, how do we get engaged? Can we clarify the role of parent carer forums in each of the partnerships? Can we clarify the role of SENDIAS services, etc.? And so if people are sat here today, they want to know whether their local area is within the change programme, how they find out about it, how improvement's going to work. What's the best method for people to find out a lot more about the programme? Because clearly this won't be the first and last time we talk about it. It'll come back. But if we make sure people are as informed as possible, that would be really helpful. Now, some of that responsibility is also probably ours. I'm looking at.
Yep, absolutely. So you've got the list on one of those slides, which say, like Christine said, will be shared, which tells you who the different local authorities are who are leading this. So very much be contacting your SEND leads, your DCSs, and saying, how can we be involved? We're pushing very hard that, particularly at the steering group level, which is the steering group is all of the local authorities in the CPP coming together and having a steering group that sits over them, so has strategic representation, not necessarily individual local authority representation. We're advising strongly that the regional PCF lead is part of that steering group, but we know a number of areas have other parent groups as well that they want to engage. So some of that's going to be down to how they want to structure themselves. But between us and the delivery partner, we'll be advising and supporting and making sure that they've got the right people on that. So that's one of the key things. So I think there's a bottom-up push from you and a top-down push from us. All
right. So I want to bring Anna in.
I'm not sure we've got sound.
Have we got sound? Can you?
Oh, no, we have.
Yeah, good. All right, that's fine. Okay, I want to finish this session just by bringing Anna in from the team to talk to you a bit about what we're doing from the REACH consortium as well.
Yeah, so the REACH consortium as delivery partner have a few different functions. So initially supporting the change programme partnerships as they test and refine, but then also to share that learning. So soon, obviously the work hasn't really got underway in terms of testing and refining yet, but that's imminent. And as soon as there's stuff to share, we'll have a really robust programme of events, learning. Our next national event, like this one in March, will be on starting to share some of what's coming out. So we'll make sure that people who aren't directly involved get as much of the learning as it happens as possible. And we have an approach to how we understand what's working and what's not working. So called rapid cycle evaluation, and there'll be a proper kind of description and explanation of what that is. But essentially understanding how the reforms are being designed, how they're working at implementation, what's not working, and we'll pull that into learning that we'll share. So absolutely, there will be lots of opportunities for people to understand as the programme moves forward what's happening and pull out what's replicable to them as well.
I think also, Anna, in sort of response to all of the questions, if we go through those and make sure that we're wherever possible answering those on the CDC website.
Yeah.
Just so that it's an easy repository, because I know I'm sure DFE may have plans as well, Alistair, but with all due respect, DFE don't always move very quickly in the comms space, so we'll get some stuff up ASAP.
So tune into the CDC website, have a look, and you will hear more as we develop. Thank you very much for that session. Thanks to Alistair, but also thank you very much for your engagement on the chat. So how do we know what's working? Well, we ask Amy. So Amy's joining us from the University of Warwick. Warwick are one of the partners on the What Works in SEND programme, helping us understand the evidence of change happen. And that's really, really important. And Amy's going to come and talk to us now about the systemic review of the work we've been doing on improvement. So you're very welcome, Amy.
Thank you very much. I'm very pleased to be here. I'm going to attempt to share my slides. So please give me a thumbs up if you can see them, because I can no longer see you.
Yeah, we can see them, Amy.
Fabulous. Thank you very much. So thank you for having me. And Christine, you are right. So I'm going to present to you today a review that we did on what's gone previously. So it's really nicely dovetails with what Alistair's presented about what's going to happen next. We've spent the last 12 months looking at what has been conducted within services, fundamentally trying to identify what works. Okay. With me. Okay, so I put a brief about what the RISE partnership was, just in case colleagues didn't know. And it is an improvement partnership between the CDC, obviously, the University of Warwick, which is where I'm based with my colleagues, and an organisation called ISOS. And the aim of the partnership is to produce an evidence-based learning system. So that's where we're going to conduct research, obviously, but also develop and disseminate resources which will be available to the wider community, looking particularly at models of effective practice. So within that partnership, where I sit is here, the research. I've just made it bold so you can see. So it's our job as the academics both to look back to see what's effective and going forward looking at evaluations to understand what works. So the systematic review I'm presenting today has got a very snappy title there. So effective service provision and partnership in service providers for children and young people with SEND. So that was a mixed method systematic review, which means we looked at all different types of literature, both qualitative and quantitative studies. And I've included a few slides here just to give you a brief overview of what a systematic review is. I think sometimes when we think about research designs and studies, trying to understand what it actually means can be confusing. It certainly was for me when I started. So I put this lovely picture that shows you the process of a systematic review. So essentially within a systematic review, you go out and search for literature on a topic of study, and it takes place in 3 phases. The first is to establish the scope of a study. So what is it we're actually looking at? And you do that in partnership with the people who are the experts. So when we started our systematic review, we worked closely with the CDC and the DFE to understand what the research questions need to be and what type of studies do we need to identify. Once that question is established, we then go off and do the study. So that goes back into the university then, where we conduct our searches, we screen and select studies and synthesize all the evidence that's available to interpret the findings and generate our implications, which then obviously form a report, which we then give back to the DFE and the CDC. So the partners are involved very much at the start and the end, and then us as the academic team do the bit in the middle where we are crunching the studies. So in this study, in this systematic review, we had 3 research questions. So it was very complicated to sort through all the literature. You'll see that as I go along and you see the sheer volume of studies we looked at. I've included the 3 research questions there, but briefly, we were looking at what effective activities are or programs, what we call interventions, generated improvements for people with SEND. And of those that were effective, why did they work? So what was it within those interventions that generated an effective outcome? And then our third study was looking at partnership. So when people working in health and care and education, when they work in partnership, how do they work and how can we improve partnership working? So they're the three areas that I'm going to review today. So this is what our systematic review looked like. We screened, so screened, that means read nearly 9,000 papers on the topic. So it was a huge volume of literature. And what we actually included in our final review to answer the research questions were 138 individual studies. And as I said, these were mixed discipline studies. So they could have come from health, they could have come from education, and they could have come from the social care setting. And equally, they used different research methods. So there was both qualitative and quantitative studies, studies that use both types of methods. And we also included previous systematic reviews. So people that have done this process before, we looked at what they said. So you can see from this pie chart, we excluded a huge volume of literature where those studies just did not answer the research questions we had asked. So what did we find? I'm going to go over these briefly before I get to the synthesis, which I think is the interesting bit. So we found 74 interventional studies. So 74 studies which report something that worked for generating improvements. We found 38 studies which talked about effective partnership working, and I'll provide more detail about those in a moment. And also 34 different types of service models which were seen to be effective for children and young people with SEND. So thinking about the first question, what are effective interventions? You can see there I've included a very brief list of those that just seem to be effective, and there were 74 individual interventions. And within our report, we do give more information about what these interventions contained and what people actually did. But going back to what Christine said about the volume of discussions and communication and interest in the EHCPs, that is, to be honest, the majority of the interventional literature we found. There was lots of studies outlining how we do it better, how we implement it, how we evaluate it. The partnership studies, we focused specifically at studies that included health, education and social care. We were trying to avoid those studies that looked at partnership only within certain settings. And we broke it down into the conditions for success, both in primary studies, so original research, and systematic reviews, studies that have been done previously. So within partnerships, to answer this research question, we wanted to know what were the partners actually doing that helped the partnership both work appropriately, but also was able to improve outcomes for children and young people with SEND. Briefly then, before I move on to synthesis, is just outlining the different service models. Again, there you can see there were various different types that were seen to be effective. So things like child development teams, virtual workforces, virtual services, and we do provide details of all these service models which have evidence of effectiveness in our wider report. The interesting thing to me is the synthesis. So this is moving on to the, okay, so that's out there. We know what works. We wanted to know why it worked and what was going on. So we looked at grouping the different types of effective interventions and what they seemed to be trying to improve. And we grouped those into 3 different areas, and then one obviously we've called other. The primary focus was on health and well-being for children and young people with SEND. So that was things like counselling and positive behavioural support. There were many interventions that were located within a school environment, looking at school settings and school liaison nurses, and then also a large number of studies that were focused within the community settings where the target of the intervention were a wider community where they had multiple partners. I think what was interesting in the study is that there were always, for the intervention, a primary focus. So it was either on a health outcome or on an education outcome. We found very few studies where they took that real multi-organisational sort of focus on outcomes where they were measuring them equally. Looking at the conditions for success, we found 8 that we've talked about in our report. Ooh, 1 second, I'm just going to scroll up on my screen. And I've listed them here on the slide. The first one being the need for flexibility, and that I think that's been talked about in the talk today, is the constant change, both in terms of policy and how organisations are delivered. So without ability to flex within organisations, within interventions, then services could not be successful. We found quite a volume of literature that outlined these bits here, that interventions need to be designed with the people that are using them. So both the providers of services, education and care services, but also the people who receive interventions. So things that are designed and delivered out of context struggle then to. And I think if you think about it, that is, you know, you would assume that's common sense. It can't be delivered unless the people doing it are invested and know what's going to happen. I think these next 3 are really quite important when we think about partnership working. So the need for regular, open and clear communication and relationship development were things that were shown to need actual work. You know, it was an activity doing this multi-agency working. And it was really great, Christine, to hear you say that you see the CDC job as sitting people around the table and ensuring that activity takes place, because these were shown as conditions for success. And without the relationship building and the communication development, the interventions failed to be implemented and effective. That also comes with an expectation between stakeholders of what's needed and also what their role is. So whilst people are used to working from a health setting or an education setting, it was the communication between the individuals saying, this is my role, this is what I expect from you, this is what you can expect from me. And having those clear expectations within partnerships really did improve how successful they could be. And the first one is also, interestingly, Christine, again, you talked about the need for seeing change as positive and generating this culture of improvement as a good thing. And I think within the literature we saw that seeing change as an opportunity to do something better does help to improve the culture and the success of interventions. Sometimes I understand the difficulties of seeing it as a positive when it feels like a constant change, but it really just changed people's engagement in the process and drive to make it work. Okay, the last slide of results I'm going to show you is our synthesis on looking at partnership working across health and social care and education. How can we make partnership working better? Yeah, so we're all expected to work in partnerships in this field. And the first one was the importance of actually taking part, so being a willing participant in a partnership, but also being allowed into the partnership. So you had to be a legitimate organisation or seen as a legitimate individual to be allowed into a partnership. And I think we saw lots of stories within the evidence from the qualitative literature in particular, where people were not seen as legitimate partners, maybe because they came from outside of health or outside of education. They were not fundamentally allowed in the partnership to make decisions in the way that other partners were. I think I touched on this briefly a moment ago, the need for consultation and personalisation with children and young people, and particularly their families. I think you all know this already, working in this space, that it's a wider than the individual child, it's their families and wider family units that need to be consulted, because they are also part of partnership working when we're delivering services. The point about communication and partnership working, I saw within the literature, again, particularly the qualitative literature, the need to be moderated and respectful. I know, again, that sounds like common sense, but we saw evidence of partnership working failing where the relationships just were not sustained. And I recognise the difficulty of that when organisations are working under pressure. But it really did come down to successful interventions being delivered by the individuals who were part of the partnership. So Alistair, you talked about the pieces being more important than the total sum, and that's entirely reflected in the literature. The people who are sat at the table really were the sort of drivers in making these things work. Also, for partnership to be effective, people had to prepare. We saw a lot in the literature about the importance of turning up to partnership meetings or partnership sessions with the information you need to be an effective partner, and the damage in situations it can create when people don't have the up-to-date evidence they need, the outcomes that others are expecting, and that leads you to a situation where you lose trust in the partnership, or you get to the first point where your legitimacy within the partnership declines. So that was quite an important learning point for us. And the final one then is the working across professional and organisational boundaries. So true effective partnership working really does require people to leave the organisation behind and focus on delivery for the person, the child that you are providing services to. And I know that sounds easy on paper. You know, the literature didn't say this was an easy thing to do, but if people were able to focus on delivery of the service outside of their expectations of the organisation, that led to more effective partnership working. So that is a whistle-stop tour of what we found was effective. I also thought it would be useful to present to you what we didn't find within the literature. So these next few slides are quite detailed, but I know some colleagues would like to take the slides away, so I've gone for more rather than less. But I've tried to bold the important things. So what we didn't find were high methodological quality evaluations. And what I mean by that are larger scale studies that include things like experience endpoints. What did the children and young people and their families think about things? What was their experiences of the service? Multiple effectiveness endpoints. So I talked about outcomes for health, outcomes for care, outcomes for education. It was rare that we found studies where all three endpoints were included in intervention development and testing. And also implementation endpoints. How do we know that improving a service or doing an innovation actually made a difference? Did it make the service quicker? Did it make the service cheaper? We did not find this type of endpoint in the literature. And also cost effectiveness endpoints. So how do we know that what we've done in one region represents better value for money than what we did in another? The next thing we thought overwhelmingly was missing were reporting standards for interventions. So across the 138 studies that we included, they varied hugely. And it was not very often that we could pool studies together and think this group of studies tell us a similar thing. Often they were sort of poorly outlined, poorly described interventions, so we couldn't ever replicate what they were doing within the study. So we can't say something is effective if we don't know what happened, who did it, what did they measure, what did they do. So within implementation studies, we have reporting standards so that somebody can pick up a final report from your study and go and replicate it in their organisation, and you would anticipate that the findings would be similar. And this leads me on to the final point, is a core outcome set for SEND provision. And this is very much focused on coming to an agreement about what are the important outcomes across education, across care and across health, and can we in future interventions and improvement activities align our outcomes so that they become comparable. Okay. My final slide before I move on to questions or comments is the recommendations that we came to at the end of our systematic review. So having read all the literature and understand what's gone before, if we were then to go on to the next step of making improvements or developing and testing interventions for improving SEND services, what would we do differently? And the first off is the consideration of the flexibility and the advantages of having flexibility within interventions. So Alistair's just briefly talked about the different geographical areas where this I can't remember what it's called, CPP intervention is going to be rolled out. And I think we have to recognise that across those different areas, we have to expect flexibility in delivery because the context of those settings will not be the same. So I think the assumption that a policy cannot be tailored to a local setting, I think seems to be missing in the literature, and the expectation that flexibility is there and essential and is expected in future studies. The second recommendation is promotion of effective partnership. Needs to be part of interventions and improvements. So the partnership work is an area of activity that is actually designed and delivered as part of interventions. So those activities that bring people together in true partnerships and allow them to be successful needs to be part of both the policy change and also the development of interventions. This takes me nicely on to the last point about focused partnership. And I think this was an overarching finding of our review, that partnership is an activity in the same way as assessment and in the same way as measuring outcomes for children and young people. We have to set time aside to do focused partnership work if we really truly want to deliver services that are effective. We all know that they can't be delivered via one organisational boundary, but setting the time aside to do the partnership work is often very difficult. And that was something that came into the literature that we recognise need to be built into things going forward. Now I've included the references here to both the protocol of the study and the final report, and also the academic publication that summarises the findings, which is due to be published very soon. But I'm also more than happy to share these with colleagues. If they want to contact me, I can email the final findings to them. I'm also very happy to take questions, so I can turn off my slides now.
Thank you very much, Amy. Do you know what? That was so helpful and incredibly well timed in terms of the change programme partnerships beginning to develop. And I saw lots and lots of comments in the chat about just how useful it was. Okay. And I think there is something about, even if instinctively we know some of these things, actually having that backed up by the evidence gives people a real confidence in being able to then pursue it and look at it and understand it. And we have so little research evidence on this that actually this feels like a really important starting point on what we are trying to achieve. You're getting fantastic response in the chat. And I think that the biggest question from people was, how do we get hold of the research? It was really helpful. And Anna, you've also put that in the chat. So we're going to send round, lots of claps, Amy. We're going to send round Amy's research with the slides and stuff from today. But as Anna said, we are also doing some work which makes some of this a bit more accessible, so that we can use this material with a range of different audiences, so we get the full full use of it. The other thing that's important is this is the start of the Warwick work. It's not the end of it. So this is the first report that Warwick have done. You can see now why we partnered with them. And as Amanda said in the chat, we have a bit of space in our contracts to do some deep dives into research and evidence. So, you know what, if you think about that important, then have a look, and do have a look at the What Works in SEND website, which Anna's put up for you. So Amy, thank you very much. That was incredibly helpful.
And Amy, would you mind just telling people about the work that's been started on looking at leadership? Because I think there were a couple of queries in the chat on leadership. that I know that Graham's going to pull out some of the learning from the DBOT study as well to sit alongside that. But if you could just kind of talk about the research question maybe, so that people know what we're focused on, that would be really helpful.
Okay, so as I said, this was the first review of a 3-year programme. So we started off thinking of everything that's happened, what's effective, where can we make improvements? And within the partnership working, one of the core elements that kept coming out time and time again was, how do we do leadership for partnership? What does that look like in such a complex system? And I think going away and thinking, can we learn what leadership looks like? So we know how leadership works within our organisations. We have our managers, we have our bosses, but how do we lead outside of our organisations into a partnership where the reporting lines are not necessarily there? So we've had to go outside of SEND services because the literature is so sort of few and far between to look at other complex systems, both across health and across care, and outside into the other public sectors, to be honest, to see how do other organisations do leadership for partnership. So that's what we're working on at the moment, is how can you lead across potentially 3 organisations at the same time to generate improvements.
That sounds enormously helpful. Right, thank you very much for that. So our last presentation of the morning before we send you off into your workshops is from Lorraine. Many of you will know Lorraine, who seems to have a different title every time she puts up a background. National Specialist Advisor for SEND, that's a new one on me, Lorraine. Anyway, Lorraine leads the NHS SEND team magnificently, and it's incredibly good to have her with us to get an update and reflections on where we are now. Thank you for joining us, Lorraine.
Thanks, Christine. I'm about to have another title anytime soon, but it will still include SEND, so that's okay. I've asked some of my colleagues from Region and from the national team who are here with me today just to pop the cameras on, because I know you've asked me to come and speak, but it's important that we see ourselves as a sort of wider team, because it isn't just me anymore. It's the wider national team and the regional team. So it's a different presentation from what you've had this morning. I've really enjoyed this morning, but it's an opportunity for colleagues who haven't heard me speak before, or just a refresher on where we're at, looking back at what we've been working on, things that are coming up, some new things that are coming up that you might want to hear about. So I'm not going to speak for a long time. I've only got 2 slides. So next slide, please. So just looking back, so I've been thinking and reflecting a bit like yourself, Christine. We can't believe that you're moving on to retirement, but I just want to say before I start my presentation that if it wasn't for meeting you my first week in my job and for supporting me through the journey over the last 7 years, I don't think we would be here today without your team and your self-support. So thank you so much for everything that you've done to support us. So I came in 2016 and SEND was in my portfolio as the senior nurse for children and young people. Now you can imagine SEND is a job in itself. So I'm now delighted to have left the senior nurse post behind and taken on the SEND baton. And that happened a couple of years ago as I moved into Learning Disability Directorate. I've got a team of 10 people, and I just want to just sort of read some of Diana's thoughts. So Diana is our family carer advisor. And whilst we haven't got our children and young people advisor in post at the moment, we've got a family care advisor, and that's Diana. And Diana said to me that, you know, she feels really like she's an integral part of the team. She's connected with the SEND networks, whether that's NMPCF or other networks across the systems. She's got to know more what's going on in region. She comes from a local perspective, but her voice is becoming broader more than her own experience. And she feels that our team's very much rooted in what's happening on the ground, and we're motivated by the experiences of children and young people. And I think that really, it's a really nice reflection, because it's something that I committed to in taking on this role, that I would have a family care advisor and a young person advisor as part of the team. So thank you, Diana, for your reflections. And I know that Diana's getting out and about and meeting lots of people. From a regional sort of perspective, I just want to reflect back on when I first started. I was asked to work with 4 regional chief nurses. some of these people are not even there anymore. I think I've worked with about 130 now, different types of people and regions. But I want us to celebrate that we've now got 17 people working in our regions, and we fund the majority of them roles, and the people who don't fund, they do it out of their own portfolios within their region. And having that ownership and working with our regional delivery model really matters, because the way that we're working now, with us nationally leading on policy, doing joint pieces of work across government, but regions supporting systems is mirroring our operating model. And if you want to read a bit more about that, the link is there for you all. And then I guess over the 7 years, I've reflected on the relationships that I've had to build. We talked about partnerships earlier on, and we'll continue to build new relationships. But I feel that we've strengthened some of the relationships across government. We've still got a long way to go, because things change on a daily basis. People change. I've had to get used to having a whole new set of civil servants in DFE. Teams and Department of Health and Social Care, and they've got to get used to working with us in NHS England as an arm's length body. So the partnerships are building, we're learning too, we're listening together, and we're working together as much as we can do. But working with our integrated care boards now instead of our CCGs, that is a big change for us, as Christine sort of alluded to earlier on. The health landscape has changed in the last year. And I just want to say thanks to the colleagues who are in ICBs. They're going through a tough time just now as they look at their structures. We've been looking at our structures, but celebrate some of the good things. I know we're working on the functions and the roles of the designated clinical and medical officers, but we're starting to see some new teams emerging. And we need to take that positivity and keep strong during this time of change. The membership of the National Online Forum that CDC runs has been absolutely brilliant. It runs on its own now, and that forum really helps you all to connect at a national level. But what I've seen over the last few years is that you've been connecting more at a regional level on a peer-to-peer, face-to-face support. And another area I just wanted to remind people of is that we've been, as part of the SEND team, Anne Gordon and the team, who's the Children and People's Allied Health Professional Lead, that was a new role that we've created. It's wider than SEND, but having Anne in post and helping with LSEC and helping with the launch of the Allied Health Professionals Network, there's about 300 people on that network. They haven't had a network before, and now they've got this network that we're about to launch and create and support others, because we need to recognise that this is all professions that are involved in SEND. So just a couple of reflections from myself. I'm going to move on to the next slide. And this is where I want to sort of just give a few sort of pointers, really. So I think I spend my life trying to help people who don't work in the health sector understand the health landscape and the wider policies and strategies within health. And we're doing that on a daily basis, and I'm asked to speak on a daily basis at different events, particularly if you're outside of the health landscape. It's not easy to understand, and I know that our regional colleagues are doing that too. If I reflect on the regional colleagues, so the SEND knowledge in regions now has really grown, it's really strong. They're supporting and they're recognised for their skills and knowledge and expertise in their annual reports. And I just want to reflect on one thing that was in one annual report that really made me chuckle the other day. The regional lead is contactable, knowledgeable and engaging. They pop up everywhere. That's a good thing though, really. And they bring parties together. And I really think that they've built collegiate relationships with DFE, with local systems. They understand the national priorities, they share the learning. And I couldn't do my job without a regional leads. So thank you for everything that you do as well. We value everybody's contributions and SEND. So this year, when I've been looking at how much money I have available, we have planned a SEND Awards event for the 12th of March. Now, the reason I wanted to do that is because I keep seeing all these awards, Chief Nursing Officer Awards, Allied Health Professionals Team Awards, and I thought, hey, we can do that. So we're planning this session and we're working on the details. We've got a call with regions next week, but I want to make sure that everybody is able to be part of that award ceremony. So more to come on that. We need to keep the positivity going and during this hard time. And I know that you've all been working really hard. It's not easy. And then when I reflect on regions in terms of their work, you all know that they work really hard on projects. They've always got a list of things. We could do this, we could do that. So last year we had 29 projects. We've not got around to sharing everything nationally yet, but we are working on that. We've got another 7 projects identified this year. And in the main, these projects and events are focused around leadership and things that matter within region. So they have co-created these pieces of work, and you will hear more through your regional leads about these events. I think, and I know all you think, that SEND is everybody's business, but trying to make sure that people know about that is a hard task. So we have to work across many teams in NHS England, inside NHS England, outside of NHS England, and across the scale of adults and children, young people services. It's a daily ask, it's a daily learning, but I can see that people are thinking SEND now. As we work across our different teams for children and people in NHS England. And we're getting recognised for us being the SEND team, the go-to people. And then I think just reflecting on networks, you're all here today because we love to network, we love to hear how each other is getting on, how things are going really well, when things are not going so well, what isn't working. And I think we always need to continue to strive for a health voice in every conversation. So it was great to hear Alistair here today, and having been at the launch event for the Change Programme Partnerships, reminding people that we can't do any of this without health. We can't do any of this without social care, and we can't do any of this without education. So it's just remembering that that health voice has to be in everything you do, just like we do with the children, young people's voice and the family carer voice. And I think that's all I would like to say. Thank you.
Thank you. Okay, I'll try again without echoing with a bit of luck. Thank you very much, Lorraine. That was just so helpful. And you indeed made me incredibly helpful when you mentioned SEND Awards. Because you're utterly and absolutely right. You know, we have some fantastic individuals on this call today, and we can see lots of stuff in the chat on that. So to be able to recognise achievement, because for those of you who are really struggling under pressure, you know, what a difference it makes, doesn't it? When somebody says, yeah, I know it's tough, but you're doing a good job. You've got real partnerships, you're making progress. And Lorraine, you are an incredible champion of making that happen. So thank you very much for everything that you do. And thank you to that regional team. And Diana, it's really good to see you here. So it's a really good example of how we move forward on both practice and culture. And we take people with us along the way. And we look forward to continuing to work with your regional teams as we move forward. So thank you very much. Right, I think I'm due to hand over to Amanda.
I think you are due to
who is sat here looking very quiet, which is very unlike her.
You are due to pressure makes diamonds. That's absolutely right. So you are handing over to me, Christine, because this is Christine's, and actually I can feel myself welling up, which I have managed not to do for an entire month. So I'm quite proud of myself. But this is Christine's penultimate day as director of the Council for Disabled Children. Just pause. And one of the things I know she has absolutely loved doing the best over the last few years has been these national events. She has absolutely loved working with all of you guys because of the amazing work that you do and the positivity that you bring despite all of those challenges. And so we've got a little poll for you because you won't all have been able to come to the very many leaving do's that we have had for Christine, but we're kind of treating this as a little online leaving do. There's a little Menti poll for you if you would like to send Christine any messages as she goes on her retirement. Just be very clear, you won't miss her for long. She's going on a 3-month trip.
You're on mute, Amanda.
That better?
Can you hear me now, Leslie?
Yes.
How many pearls of wisdom did you miss there?
We got the 3 months trip in.
Okay, excellent, excellent. So after the 3-month trip, she is coming back to be what she has. Well, she's promised not to be the mad granny in the attic. She's absolutely promised not to be that. But she's coming back to be a strategic advisor. We will certainly be expecting some of the reach change program partners to call on her expertise, and she's going to carry on chairing some of the improvement boards. Loving all of
the
stuff.
Thank you, Matthew.
Having managed to avoid tearing up, now I'm going to have a coughing fit. So anyway, you will see Christine again. But yeah, this is her penultimate day as director of the Council for Disabled Children, and we could think of no more fitting end than her chairing this event in the morning and getting to spend some quality time with you guys. So thank you very much for contributing to the poll, and thank you very much, Christine, for having been you. I think that's all. Oh no, it's not. I've got some flowers. Doing it properly, no. There you go, not even virtual flowers, real actual
lovely.
flowers.
Thank you very much. Look at those. They are lovely. Thank you all very, very much. You are all fab. I know it's tough. I know it's hard work. I know it's pressurized. But you know what? For the last however many years, I would not have ever wanted to be anywhere else, and I would not have wanted to work with anyone else. So for me, it's been an absolute privilege going around the country, finding out what you're doing, listening to your challenges and listening to your achievements. So thank you very much indeed.
Okay. And I think we are now giving people a little break before some workshops. I'm looking at Anna for confirmation of that.
Yes.
Yeah, how generous have we? Oh, go on,
Macy.
Sorry, Amanda, we've just got another poll, just the same one that we did at the start. So I'll share that, and then we've got a little evaluation link for anyone that's not heading to workshops as well. So we've just got that same question from the beginning there.
There you go.
Right.
Tried to derail Macy's carefully laid plans, but she got in there and prevented me.
Macy's very good
She
at
is
detailed
very
plans. We just have to rely on her.
And please do fill in the poll, because I know it's time consuming. Well, it's not very time consuming, but it is, you know, a bit of a faff. But it is, DFE do like to know that we've done a reasonable job. They do ask us about it, and this is part of the evidence that we provide to them to say, yes, DFE, we did a good job. So yeah, please do the poll. We would be incredibly grateful.
And I think what's been really clear is how helpful it's been hearing from Warwick. So as soon as there's more outputs, we'll make sure we feed them into webinars and events so that people get a sense of what's coming out of that research too.
Absolutely. We will, you know, I think it sort of sounds counterintuitive because it's an awful thing to say, but I was quite encouraged. We were in a local area the other week and they said things have never been this bad.
I've seen that today.
And actually the reason that was encouraging was because their perspective was, you know, things can only improve from here. So there is such a lot of energy. We have never had the focus for our group of children, young people that we currently have. And I think, you know, whilst it may be slightly depressing that, you know, when Warwick went to do their evidence review, there was insufficient evidence about what works in SEND. You know, we do now have a programme that's setting out to address that. You know, small green shoots, but we are absolutely moving in the right direction, and you can rely on CDC to carry on working ceaselessly to continue to do that with your help. Have I done everything I need to do?
Yeah, I think
Lucy?
Macy might just show the polls on the screen just so we can see.
Oh yes.
Yeah, I'm just going to start by showing, I'll show the question we asked at the beginning. So nobody and little to no understanding, which is great.
That's good. That's moving in the right way. Excellent. Okay. Move from red to amber.
Excellent.
That's what we like to see. Okay, thank you, everyone. I think we do now have a break before workshops, yeah?
Yeah, workshops start at 12. You should have, if you signed up, you should have another Teams link in your calendars. There are 2 workshops. If you don't, Adiba can help with that. We'll stay on this call and support, or Adiba's put her email in the chat.
And thank you, everyone.